Hello, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to introduce Dr. Devin Bourgeois. Dr. Bourgeois is a specialist in internal medicine who recently joined our staff and will be taking care of patients in the 7-parish area that we service. We want to spend a few minutes with Devin this morning talking about his training so people maybe have a little better understanding of what internal medicine doctors do. Where he trained, a few facts and figures about that maybe, but also just to get to know Dr. Bourgeois better. He's from our area, and with that intro, I'll turn the time over to him for a moment or two.
Well, thank you for having me, Greg. I'm born and raised in Thibodaux, went to St. Joseph, I went to E.D. White, I went to Nichols, I then moved on and went to LSU New Orleans for medical school, and then went right down the road to Baton Rouge, to the old Earl K. Long medicine program, which is now situated at Our Lady of the Lake Hospital. I trained there. I spent 5 years in Baton Rouge doing clinical rotations and studying internal medicine. I married a local girl from Thibodaux, Catherine, and we have one daughter now. We figured Thibodaux was a phenomenal place to live and decided to come back and hopefully spend many, many years treating patients in this area.
Great. It's great to have you here. We've had a lot of conversations. When young docs come home to this area, they really have, I think, an excellent opportunity to be successful because they love the people here. Many of them, and I think including you, feel appreciative of what people have done for them in their younger years, and they feel a little bit of, we'd like to give back to the community, and on and on and on, that make that whole scenario a very, very good one. Why don't we talk for a moment or two about internal medicine? What is internal medicine?
So internal medicine is, training in internal medicine is 3 years of more adult medicine. We say we treat kids 12, so more adolescent and on to the end of their life. We focus primarily on the aspects of medicine. We don't do much training in surgery or like OBGYN type stuff, maybe as somebody like a family medicine program would. We focus 3 years primarily on that. Many go on from internal medicine to specialize in things such as cardiology and gastroenterology. So in our rotations, we spend a lot of time with the cardiologists, with the GI doctors, with the kidney doctors, with the endocrinologists, which give us a lot of experience to treat these more complex disorders. But we don't neglect the simple things, such as, just simple infections, sinus infections, cold, flu. But really the biggest thing that we're trained on, we really want to focus on wellness and focusing on keeping people healthy in preventative medicine, because we understand that if you prevent all these diseases by, eating right and exercising, we understand that you can live a long and healthy life by doing that.
Great intro. Appreciate that a lot. So once a person kind of gloms on to a internal medicine doctor, that doctor can take care of them for many years to come. And can be very helpful in that fundamental aspect of being healthy and strong. We developed our WellFit program here, which you're very familiar with, which we can really help people specific to their needs, not just some generalization of how people can be healthy. What I've noticed with the COVID patients, we have a resurgence of that now, and it's nothing, it's very serious stuff.
Sure.
The same thing occurs. It is people are taking better care of themselves. They just do better in dealing with COVID than those that don't. Do you want to comment on that?
Absolutely. The biggest things for COVID that we're concerned about, people who are obese, people with high blood pressure, people with diabetes, over the general population do much worse with COVID than somebody who, even if they have those things, if they're well controlled, they typically do better with COVID. And I've had quite a bit of experience treating COVID in my training in Baton Rouge at the lake. And now I hope to transition that back here soon.
So from the more acute problems that people might have, definitely your training will prepare you for that. For long-term chronic illnesses, diabetes and so forth, the same. And for other things that just come along, as you alluded to, sinusitis or something like that. Your training would lend itself well to that. Dr. Devin Bourgeois, internal medicine physician from Thibodaux, Louisiana, recently finished his training in Baton Rouge, and great young man, great family, great person from this area. Thank you.
Thanks.